Today's drug is Trazodone. Brand names Desyrel and Oleptro. The therapeutic category is that it's an antidepressant, more specifically a serotonin reuptake inhibitor. The main indication for Trazodone is its use in major depressive disorders that are unipolar, and there are also off-label uses that are commonly seen, such as insomnia. Data suggests that patients with or without comorbid conditions may benefit in short-term usage regarding number of awakenings and their sleep quality. Another off-label use is for aggressive or agitated behavior associated with dementia. There is limited data suggesting Trazodone may be beneficial in decreasing dementia-associated aggression or agitation. Dosage form and strength. There is one main dosage form, which is a tablet. It comes in a 50 milligram, 100 milligram, 150 milligram, and 300 milligram strength. Dosing by indication. Dosing for unipolar major depressive disorder in adults. The immediate release tablet, initiate the patient at 50 milligrams by mouth twice daily. May increase in 50 milligrams per day increments every 3 to 7 days to a target dose between 75 and 100 milligrams twice daily. You may continue to increase in increments between 50 and 100 milligrams per day every 2 to 4 weeks based on patient tolerability. Typical dosing range is between 200 and 400 milligrams per day with a max dose of 300 milligrams per day. Doses of greater than 400 milligrams per day are associated with an increase in adverse effects. Smaller daytime doses with larger bedtime doses are recommended to avoid the sedative effects of Trazodone. The extended release tablet, when treating MDD in adults, initiate 150 milligrams by mouth at bedtime, may increase in 75 milligram per day increments every 3 days based on patient response. The max daily dose is 375 milligrams per day. Dosing for unipolar MDD in geriatrics. The immediate release tablet you initiate between 25 and 50 milligrams every night at bedtime, with 25 to 50 milligram per day increases every 3 days if tolerated. Between 75 and 150 milligram per day is the common therapeutic range that is seen in the geriatric population. The extended release dosing for treating MDD in geriatrics is similar to the adult dosing. Off-label dosing for insomnia in adults. The immediate release tablet is initiated between 50 and 100 milligrams by mouth at bedtime. A lower dosing range between 12.5 and 50 milligrams may be considered in palliative care patients. May increase based on patient response up to 200 milligrams each evening at bedtime. The immediate release tablet, when treating patients that have both depression and insomnia, initiate the dose between 50 and 300 milligrams by mouth at bedtime. Off-label dosing for insomnia in pediatrics. Although there is data that exists, it is not approved for use. Mechanism of action and pharmacology. Trazodone works through its inhibition of serotonin reuptake through the adrenoreceptor subsensitivity. 5-HT2A receptor antagonism causes significant changes in the 5-HT presynaptic receptor adrenoreceptors. In addition to serotonin reuptake antagonism, Trazodone also blocks the H1 histamine receptor as well as the alpha-1 adrenergic receptors. The medication is well absorbed. Food increases absorption, but it also decreases the peak concentration. Metabolism. Trazodone is metabolized hepatically extensively through the CYP3A4 pathway to an active metabolite. Excretion. 74% is excreted primarily through the urine and 21% fecally. Onset of action. Initial effects are seen within the first 1 to 2 weeks, with full benefits often seen through weeks 4 through 6. Time to peak. Immediate release is between 30 and 100 minutes unless taken with food, which will extend it to about 2.5 hours. Extended release is approximately 9 hours, with food no longer being a factor. The half-life elimination is between 5 and 9 hours and prolonged in obese patients. And the medication is between 89 and 95% protein bound. Special populations and considerations. Discontinuation of therapy should be gradual over 2 to 4 weeks. Switching to or from an MAOI requires 14 days between each drug. Side effects. Sleepiness, dizziness, low blood pressure. Serotonin syndrome is of concern with symptoms such as agitation, hallucinations, coordination problems, fast heartbeat, sweating, fever, nausea, vomiting, diarrhea, and tight muscles. Another signature side effect is priapism, which is an erection lasting more than 6 hours. More side effects are visual problems such as eye pain, changes in vision, swelling, and redness in or around the eyes. A common side effect that is seen with all serotonin-affecting medications is bleed risk. So drugs that interfere with serotonin reuptake has been associated with bleeding and bruising. Trazodone does have a black box warning for suicidal thoughts and behaviors. Antidepressants increase the risk of suicidal thoughts and behaviors in pediatric and young patients. Monitor for clinical worsening and emergence of suicidal thoughts and behaviors. Trazodone is not approved for use in pediatric patients. Drug interactions. Alcohol may enhance adverse toxic effects such as sleepiness and dizziness. Other CNS depressants may enhance effects of trazodone. Drugs that affect serotonin, such as amphetamines and antipsychotic agents, may increase the risk of serotonin syndrome. And CYP3A4 inducers and inhibitors should be monitored or adjusted when used with trazodone. Monitoring parameters. Monitor for clinical worsening and emergence of suicidal thoughts and behaviors. Monitor for irregular bleeding, bruising, QT prolongation, CNS depression, LFTs, and also monitor for serotonin syndrome signs and symptoms. Patient counseling information. Immediate release tablets should be administered right after a meal or snack. Extended release tablets should be taken on an empty stomach. And trazodone is used to treat low mood and may also be used for insomnia.